All right, we're going to move on to Francisella. Francisella, overall, is a pretty low-yield organism for step 1. I'm going to tell you where it may show up, and that is because it does tend to be on the list of potential agents for biological warfare. Okay, so it could show up in that situation. I'm going to show you some of the ways that you can naturally acquire Francisella, and we'll talk about some of those specific diseases. So these are small gram-negative rods. They are facultative intracellular, like we talked about with Legionella and a lot of the other organisms. And the main species we're going to talk about is Francisella tularensis. The disease, then we would call tularemia. So I mentioned it is gram-negative rod, mentioned the potential for use in biological warfare, and it is also a zoonotic disease. So here's one of the diseases we can actually acquire from animals. That means it's a zoonoses. Now, the reservoir for the organism tends to be a lot of different mammalian species, rabbits, for example, and deer. Although when you think about Francisella, you typically are thinking about rabbits, okay? Because we actually have given the disease the term rabbit fever, all right? So that should help you remember that. Very high association with rabbits. Now, transmission of Francisella is through a tick bite. It's one of the ways you can acquire the disease. Now, very high yield for step 1 of the USMLE. They love vector questions, okay? So we know this is zoonotic. We're getting it from an animal. How is it getting transmitted? It's getting transmitted by a tick, okay? So the tick is going to bite the human, and you're going to get a lesion at the site of the bite, and we call this the ulceroglandular form of the disease. So you get an ulceration at the site of the bite, and the draining lymph nodes will become enlarged, and eventually you're going to get a little bit of necrosis, all right? Now, very similar to that, again, here's where the rabbits come into play. In rabbit hunters who are skinning rabbits, if they accidentally cut themselves, they can actually implant the organism into their skin, and they would also get the ulceroglandular form of the disease. Another presentation is aerosols. So as, again, a rabbit hunter skinning rabbits, you're inhaling some of the aerosol. As you're doing that, you can actually get a pretty severe pneumonia with Francisella tularensis. So you want to think rabbit fever, Elmer Fudd, the whole Bugs Bunny thing. And finally, ingestion of undercooked, what kind of meat? Rabbit. You can get what's called typhoidal tularemia, so a GI version of the disease. Again, I'm going to say fairly low yield. Now, what's interesting is, when I mention about biological warfare and you think of the different transmissions, how do you think this is going to work? Do you think we're going to release a bunch of infected ticks into a room and hope for the best? Or do you think probably the best mechanism is going to be by aerosolization? All right? So this would be one that would tend to be spread via aerosols, okay? And so we're looking at low-lying, crop-dusting, plain-type situations for the spread of Francisella, okay, in a biological warfare type of transmission. As far as pathogenesis goes, again, it's facultative intracellular, so you're getting the granulomatous response that we talk about. The disease we mentioned already is tularemia, and I just went through all the different types of diseases that you can get. We do see this in the U.S., and we find it in pretty much all states in the continental U.S., but its highest incidence is in Arkansas and Missouri, okay? So again, if there's a mention in the vignette that you had a rabbit hunter, or you had a hunter from Arkansas or a hunter from Missouri, that's when you might start thinking about a naturally occurring case of tularensis. One of the things they're going to ask you about, though, they're going to describe the disease. They're going to require you to think about what the diagnosis is and ask you how it's transmitted. They're going to want to know what insect vector it was. And you're going to see ticks, fleas, flies, mosquitoes, body lice are all going to be in that list of possible vectors. So you definitely want to know that that's transmitted by the tick. Now, diagnosis is usually by serology, so they're probably not going to tell you any of the diagnostic tools that they use. This is going to be one you're going to have to pick up based on history and the clinical presentation. And it is treated with streptomycin. Okay, that's pretty much the drug of choice for Francisella. Prevention pretty much just goes to preventing the tick bite, and there is a live attenuated vaccine for persons at high risk. Now, who's at high risk for tularemia? Okay, anybody that has an outdoor kind of job, forest rangers, somebody that might easily get bitten by a tick. Veterinarians are also considered high risk for a lot of the zoonotic diseases. So those would be individuals that might consider getting the vaccine. In this case, you see that it's a live attenuated vaccine. What that means is that someone that's pregnant or immune compromised cannot get that vaccine because it would have the potential to be virulent in that patient.